Normally, our digestive system takes apart sugars and then they get absorbed into our blood after a meal. The sugar in our blood is actively inserted into the blood by a hormone called insulin, which is created by the pancreas. But this process does not happen as it should when a person has diabetes. Diabetes is one of the more common diseases in the Western civilization, and the rate of people who have had this disease has doubled itself in the past 20 years. By understanding the risk factors of diabetes, we can reduce the amount of people who get this disease. Type 1 juvenile diabetes, common among young people, causes the destruction of the pancreas cells which create the insulin, and as a result causes an extreme lack of insulin. Due to the lack of insulin, which is supposed to insert the glucose into most of the bodily cells, the patient needs to regularly inject themselves with insulin. Type 2 adult onset diabetes, more common among the older people. This is an acquired disease that has direct influence by unhealthy lifestyles such as unhealthy nutrition and a lack of exercise. Unlike the juvenile diabetes, where the blood does not get enough insulin, in the adult onset diabetes, the cells which are supposed to get the insulin resist it, and the result is the cells do not get more sugar. In this type of diabetes, the patient usually takes tablets regularly. Common emergency situations among diabetics. The common emergency situations among diabetics are hypoglycemia and hyperglycemia. Glycemia meaning glucose, hypo meaning less, and hyper meaning more. Meaning that in hypoglycemia, the patient will have too little sugar in his blood, and hyperglycemia, the patient will have too much sugar in his blood. Hypoglycemia is usually caused by injecting too much insulin, missing meals, irregular exercise, puking, and diarrhea. How can we recognize hypoglycemia? Hunger, pale skin, sweating, changes in consciousness levels, rapid pulse and breathing, seizures, nausea, and of course, low sugar levels in the patient's blood. If the patient is fully conscious, give him food with carbohydrates and sugars, as to hide the sugar levels quickly in the long term. If the patient is not fully conscious, call an ambulance so they can give him an infusion with glucose. Hyperglycemia is usually caused by not injecting enough insulin, or not taking the right amount of diabetes medicine, or an infection. How can we recognize hyperglycemia? Slow decrease in consciousness relative to hypoglycemia, high amount of urination, acetone smelling breath, stomachache, thirst, rapid pulse, rapid and shallow breathing, high sugar levels. Treatment. We will give the patient a lot of water and take him to hospital.